It's a full house of Cedar Medical Plaza. Professionals woman our studio Hamza Patrick has paid his dues with an in-depth education on what typhoid is. Yeah, twaswa na fe no. Yeah, babak ne ye Desmond Techi Atobra I didn't come out one a biomedical scientist at Cedar Medical Plaza and Dr. Osman Mutada Jr. one so our menchaya ebano any ehun sensem dia wakwadare pa. Gentlemen, good morning.
Good morning.
Nah, I know what to say. Because I know what to say because when we saw lucky, where he's saying, he said, but where is this guy taking this conversation? I say good morning to me and then say, how are you? But how are you doing, my brother?
I'm doing well.
I'm doing well. Thanks for asking. So, you're welcome back because you've been here before and we've had a conversation. But for the benefit of those who are listening to us for the very first time, because I sit here and I talk about Cedar Medical Plaza, who are you guys?
Okay. See, the kind of my main fa akwenye is na minchia wetie fo nyina. Nti Cedar Medical Plaza a facility bia ya Ghana here. So someone sat down and thought of the fact say it looks like Ghana hani ya wono. Before you visit or when you visit a health facility, it's like ubekwa ko hu ebia a surgeon and abu hu ebia a normal practitioner nebia say ohwena se de how no untimi a then we refer you to see a different specialty or a different what's it called specialist at a different facility. So like someone going through all these stresses in that form. So someone sat down and thought of the fact that what if we can create one umbrella where we bring different specialists ebeba under one umbrella on that same premises. Then you get a specialist for ABR and eye, get a specialist for dentist, get specialist for all these sides, so that if you visit a normal practitioner, not like or refer you to place enquire quarantine, so that all those specialists are under one umbrella. Into Cedar Medical Plaza, a single facility, a housing individual specialist. Okay, so it's like a private person, okay, independent people united. Until your spaces are rented out to give individual specialists to come and rent the place to provide their services all under one umbrella. Until I say mall, no, like a one-stop shop.
Interesting.
So once you get there, it's like all the services that you would need, you get it there. Once it's medical related. So that is the whole idea behind Cedar Medical Plaza.
So, as we speak now, no, specialist facilities are here and a more under more umbrella. No?
Okay. Nti your eye vision, iPhone, okay, and your Aries Aesthetics, and your Hag Hospital, so on this year, and I see the diagnostics now, so
okay, all right, that's interesting. So now let's come to your field. More side, no more
okay. Nti we see the diagnostics, no. You share specifically the lab and imaging side. Okay. Into lab side, no, very whatever test you can think about, lab test you can think about, Then imaging side, so general X-ray, scan, ECG, okay. Into once anything related to diagnostics, that is a side,
Interesting. Into obi episode be imagery of the status of the organs or ne hunem diemwa obam honoma after said doctor ahwene wie no mobetimi ayesa test ni nyina arane ama no.
Exactly. Once oba doctor never man request form. Into on the request form no panel of tests also like ni panel ye no ni nyina request form so. Into once we get the request form and we know whatever the doctor wants us to do, we'll be able to do whatever that the doctor is requesting for you.
So and you nyina na yapomodin hu hia yen. Anti masora no pay me say no the last time I'm here general check of my body no was let's say 2-3 years ago. Many aba me ho so. And the person be check so anya bia no ebia many problem with my sight. But anya bia makoma the rate at which I ebo no sa na was ebo na and kidney disease and one bebre, liver disease and one bebre. If I walk into your facility I will walk out of the facility having all these things being done for me.
That's what we are talking about. That is all we are talking about. Say, you don't have to. I always say the normal Ghanaian or better not say, actually, asate feel some foolishness be answer no visit facility. We don't have to always sit down and wait say like sign your money into answer no visit facility. Just walk into Cedar and say that into your different packages. Packages in your total to need.
Okay.
So let's say me pay ABI like this particular package, then it will give you a basically a comprehensive checkup on yourself, so that whatever that is wrong with you, coming out of the facility, you know, say, ABI me cholesterol na kosro, into wase me teso, ABI me BP no a bottle to say me reducing my activities be, ABI me kidney ne ho atochima, me shame in your maybe so it will give you a comprehensive screening of your whole body test. No one who like the ecosystem system.
Interesting, but actually, I am not private in there. Your babu is a trimushin because Ghana names be a private beyond, be a public beyond, and a bono from about private facilities. Animal bono, I was on a piano. Sikasem to say.
Yeah, meaning the cranny. Cedar, one of the facilities, sir. You who say in Suto, so for my idea. Nti, I say, like, yeah, economy is what the ecoso Ghana is siano. Nti, you're making sure say your price now one of the moderate prices you can actually get in Ghana right now when it comes to like, providing services. So it got to a time I actually saw one of the price of our test and I was like, I asked the medical director like this price for real. My age more other places. Like, but getting to know this price, like, yeah, so we understand what is going on right now. Anything like you're reducing to that extent. So they will be a benefited from that service I provide.
Interesting. Yeah. Now, I am the PM with me alcohol free. Do you offer those free services at your place? Say, checking the pressure. I announce that all the time.
Oh yes.
So or check it in a site at the same. I announce that all the time. Does it happen?
It does. You can walk in freely and check your BP, check your eye free, no cost involved, nothing. Yeah.
Wow.
Wow.
And then when I saw you, Anna.
Oh, Debbie. Yes, sir, but you say, yeah, so you nyam juma kakra e betimi aye e dia boa society no what you say and you be an e betimi akogina pulpit echi e preach but kakra bi en say wo side e betimi aye dia boa amansa no ye kakra e be ye no. Interesting.
And me the last time by me test, you run a couple of tests for me, and I got to know a lot about myself that previously I didn't know. Now moji NHIS for cardi moji bi o.
Okay. Nti ye gi NHIS, but the woman say NHIS no if company na wo be a company na we industry bi anyo mo ye adwuma then e be a company no has registered with NHIS, so oba in the name of company now holding an NHIS card no you be general like a show discount and all that it will cover that.
Okay.
So basically that is how the NHIS works
at your place. That's with a corporate entity.
Exactly.
Okay. Interesting. Catherine Okansi, you're watching me live this morning and you're telling me that you're enjoying the conversation we're having this morning. Catherine, good morning to you. You are a medical personnel as well, and so if you say that you're following the conversation, obviously there's something you find interesting, worth listening to. Look, I remember when I in Nkomo, and you want to see OBS, we are all concerned about our eyes, and so let me ask about eye vision, the kind of services you also provide at your end.
Yeah, so eye vision basically, like the name suggests, even though it's not the word eye, yeah, it's a letter I, but as you already know, eye vision is all about the eye. So it's an optometric facility located inside Cedar Medical Plaza. Okay. And we do our stuff in hand with the other facilities that are available. What we basically do is to screen your eyes for any eye ailment. Okay. So it could be something that you would require glasses. It could be something related to medication. It could even be a surgery. Even though we don't have a theater at Eye Vision Center, if you have any problem that will require you to do a surgery, we have sister facilities that we can recommend. So you go and then you do the surgery, you come back to our facility for us to do the post-surgery management.
Interesting.
Apart from that, you don't actually have to have an eye problem before you can walk in for an eye test. A lot of people have diseases and then eye problems that they are not aware of. And it will only be revealed after you've done an eye test, because some of the diseases like glaucoma, for instance, it would not show until it's in the latter stages. So if you don't walk in and then have a comprehensive eye test, you never would know until it's actually causing a lot of damage in your eyes. So I would recommend that if you have any eye issue or you don't have any eye issue, you can take advantage of the free screening that we are doing for the public and then walk in for an eye test.
Interesting. So somebody is following the conversation and is asking, so Sammy, if I don't have any signs or symptoms of an eye problem, I could just simply walk into eye vision for examination, and after that, if they find anything, they can treat me. That's a question that a friend who is following the conversation has just sent me.
Yes. So if you don't have any problem, just say, okay, I was watching your program on ETV Ghana, and you mentioned that you are doing a free screening for the public. So I'll just take you through the procedure. Maybe you already have some particular test that you want to do, you can mention it and we'll do that for you. If you want to have a general test, I will do that afterwards, and I'll tell you you have this problem or you don't have any problem. And if you have a problem, maybe I have to give you medications or I have to put you on glasses. That's what you would pay for. But for the test, it's going to be free.
Wow.
Yes.
Wow. Interesting. So whilst people are following the conversation, I've seen a couple of, people, friends who are sending me, I'm trying to just go through. Okay, so one of my friends who's following the conversation is asking that, Sammy, with the way their prices are cool, as the gentleman said, wouldn't we have a situation where we'd go and sit there and there are long queues that we are trying to avoid at the public facilities? So any of you can answer that question for me.
So at Cedar, you don't have queues. Where we are located, for instance, it plays a role because it's not in the center of town that you have a lot of people coming in. At Cedar, if you come in and you even meet a queue, it will be like 2-3 people. And we have a lot of people available to help. So it's not just one person that's working on the patients. We have a lot of consulting rooms. So if you come in and there are even 2-3 people, it will take like maximum 15 minutes and you are done. You can go back home. It may not even be up to 15 minutes. Yes.
It may not even be up to the
15 minutes. Yeah.
Interesting. So for those who are watching us this morning, because of time, for the eye especially, what advice would you give us as to taking care of our eyes today? Because even this morning I woke up and my eyes were a bit itchy. And immediately you guys came to mind that I need to call you guys to find out why my eyes itchy. But on a normal day, I'd have called one of my doctor friends and say, Charlie, I need to come here. A drobe na menton from Guso. Or I walk into a pharmacy shop and I say, Madam, can you get me something for my eye? What advice would you give to us in terms of caring for our eyes?
So, like you mentioned, a lot of people like to work in the pharmacy and then buy drugs. And in Ghana, most of the people selling the medications are not pharmacists. Even if you are, that's not your specialty. So if you have an eye problem, you may walk in and then they give you a medication that is not for what you're actually having a problem with. So like you mentioned, itching is a sign of an allergy. But you may go in and then they give you an antibiotic. When you go in, most of the patients that come in with similar complaints, they go to the pharmacy and then they get chloramphenicol, which is, what's the name?
That's
an antibiotic. They give that to you, that's not for itching. And then you go and then you use it. Maybe it may not be itching. You may have a cut on your eye, you walk in and then they give you an antibiotic that may contain a steroid, which will make your condition more escalated. So it's not advised that you walk into the pharmacy and buy an eye drop. The moment you have an eye issue, you come in, they do the test, and then they will tell you this is the problem and this is the medication you are supposed to get. So you don't just walk in to get that. Another thing I would like to say is that we are in the digital age where everyone is using a digital device. It could be in the form of a phone, a laptop, or even the TV set. And these digital devices, they emit UV and blue light. Blue light can actually mess up with your sleep pattern. Naturally, you sleep during the night and then during the day you are awake. But when you are using digital devices for more than 2 hours in a day, it messes up with your sleep cycle because it's going to suppress the production of melatonin, which is responsible for inducing sleep. Once it does that, you may end up waking up in the middle of the night and thinking, oh, I'm having insomnia. But it's because you've been using digital devices without any form of protection.
Just a quick one before we end the conversation on the eye matter.
Yes.
Is it advisable that, you know, like me, because of my job, I do, so usually by 9, I should be asleep. So before I go to bed, my light is off. I dash to my Joy Online, I check what is there. I dash to Happy Ghana, I check what is there. I dash to others to check stories before I go to bed. And this is in the darkness.
Yes.
Is it advisable to use your phones in the darkness?
Because the phone has its own light, so it may be okay, but the phone itself is emitting blue light, like I already said. So you are supposed to get a protective glass. There's the blue UV lens that protects you against these blue lights. So if you are going to use your phone in such an environment, then you have to put something on. Because once the lights are out, automatically your phone, the light will become brighter, which is very harmful to the eye. Apart from causing damage, it may even cause discomfort.
Interesting, interesting. All right, so on that note, I will thank you for joining me this morning and for having this very insightful conversation with me, Desmond and then Doc. And I'm hoping to pass by so that you check me out to see, Charlie, what is wrong with the system and to complete the full course of my body scan, which I haven't done.